Okay, everybody seems to like the surgical videos. I want to make this point. I'm not an advocate of somebody doing complex surgery if you don't have some hands-on surgical training. That includes implants, wisdom teeth, anything that's complicated. I had 2 years of surgery training in the oral surgery department of Baylor Dental School after dental school. So these videos are not intended to teach you from dirt how to take out a complicated wisdom tooth. If you have surgical training, they're intended to enhance your technique, hopefully. So that's what this is. This is a case where I had to section impacted wisdom teeth and a technique for doing that. So you can see we've got 4 wisdom teeth. What do I see when I look at that? This young man was about 18 or 19, and when I look at this, I think these are going to roll out. The upper are not going to be a problem. You want to put a 2x2 in the mouth, an elevator right here, and they should just roll out. These, though, because of the angle and because you don't have much space behind them, see on both sides, you don't have a place to elevate them into. If they were more upright, you could probably elevate these straight out without having to create a space to move them into. So the key with sectioning is you've got to have some space behind the tooth when you elevate. You can't elevate it straight into bone. So you can create the space by either cutting part of the distal of the tooth off or cutting a little of the bone back here. And then if you section it, look at the radiograph ahead of time and see how you're going to section it. So I know I want to section this tooth right off the occlusal distal of the second molar, right through the furcation, and then the same thing right here. You want to keep in mind the vertical height of the tooth from here to here, because what is the one thing you absolutely don't want to do? You don't want to damage the inferior alveolar nerve, which is right here at the tip of the tooth. So you only want to section to about right here. My plan is I'll be rolling these out, and these I'll section to about right here and to about right here. So I like to study the radiograph for a minute or two before I take the teeth out, just to know what I'm getting into. If this was a horizontal impaction, then you would section between the crown of the tooth and the roots and take the crown out. Then you'd punch a hole in the roots and pull them forward and take them out separately. That's another video. Okay, so painless and profound local anesthetic. You can watch the video on that. So important. Painless and profound local anesthetic cannot be overemphasized. So see, I've given the mandibular block, and then I'm giving an intraligamental into the periodontal ligament of those lower wisdom teeth. So you're making incision up the ramus of the mandible. This is a distal wedge. Somebody said, are you worried about damaging the lingual nerve? No, I'm not cutting past the distal lingual of the second molar. So you're keeping it on the ramus of the mandible. Now I'm going to take this piece out to expose the tooth. Then I'm going to cut with the scissors up the ramus of the mandible under the periosteum. I want to release the periosteum so I can reflect that back. This is a periodontal elevator. Access is so important. You want to be able to see what you're doing. So you can see here's the tooth right here. So I'm first removing any bone over the top of the tooth. So this is an electric handpiece and a long shank round burr. Main thing is you don't want to reflect the attached gingiva from the lingual. You don't want to blow any air under that lingual tissue. So I'm cutting around the distal of the tooth, and now I'm sectioning the tooth. So I've created a space to elevate the distal part of the tooth into, and remove a little of the bone on the facial. And I'm also removing tooth structure. Just a real light touch, creating a little more access If you're not used to taking out impacted wisdom teeth, you can get lost. Funny, when I was in my fellowship program, I was moonlighting in a dental office. One of my friends called, one of my dental school friends that didn't have surgery training, and he was trying to take out wisdom teeth on this person on a Saturday. He said, "Steve, I'm desperate. I've gotten lost back here taking out these wisdom teeth. Can you do this case?" So he put the patient in his car, drove it over to the office I was working in, and I took out the wisdom teeth. So if you're used to looking at it, you don't get lost back here, but you can get lost. Okay, so I've sectioned just like I showed you on the radiograph. The distal part, I've created a little space back here to move that distal piece into back there. I'm sectioning between the roots, not going past the furcation. And there's the distal part that I've sectioned just to the furcation. Once you take that out, especially if it's a young person, it's pretty easy to remove the mesial section. So you'll just put your elevator, either a periodontal elevator, periosteal elevator, or the 301 into the mesial of that root, and it'll should just pop right out if you have enough occlusal space. So this one, it was too wide to get out of the orifice, so I'm cutting it in two and taking it out in two pieces. I don't ever like to be rushed, especially when I'm doing surgery. So I've popped that into two pieces, the facial and the lingual, and then they'll come right out. It's kind of like a Rubik's Cube. There's the pieces. Be sure you remove the follicular sac, and then I'm packing this with socket paste and toe packs and this Surgicel. And I've never had a dry socket in 40 years because if you don't lose the blood clot, you don't get a dry socket. See, a dry socket is the nerve endings in the bone exposed before the connective tissue lining is formed in the socket. It takes 7 days for that connective tissue lining to form. So you want to preserve the blood clot in the socket for 7 days. So this medicated matrix of Surgicel in the socket keeps the blood in there, and it covers the nerves in the bone so you don't get a dry socket. You don't lose the blood clot. So the key is 7 days. You want to keep it in there, keep the clot in there for 7 days. This is 3/0 gut suture, and I usually put 2 in the mandible and 1 in the maxilla. Now you can wrap either 2 or 3 times. Oftentimes I'll go to 2 because if you do 3, you may get a loop in 3/0 gut suture. So sometimes I'll go 2 away from me, 1 toward me, and then 1 away from me. See, so here's my second stitch, which is a little bit further up the ramus of the mandible. And this I'm going 1, 2, 3 away. A lot of times I'll go 2 away and then 1 toward me and then 1 away, just to avoid getting that loop in the suture. So what I was doing right there, I was re-anesthetizing the maxillary third molar on the left side, and I was giving an intraligamental. Very important that you give an intraligamental with the 30 gauge needle and sitting as 4% plane, because you don't want them to feel anything. And just infiltration often won't do it. So I'm making a vertical cut at the distal facial of the second molar, then cutting around in the sulcus of the second molar. Then you want to reflect that tissue, and then I'll put the periosteal elevator on the distal of the second molar between the distal of the second molar and the wisdom tooth, and it'll just pop right out. If you can do these on a 16, 17, 18-year-old person, they're so much easier because the follicular sac is still present and it's lubricated. It'll just pop right out. And then go ahead and finish it with a 301 elevator. Remove the follicular sac, and then I'm going to use 1 3/0 gut suture most of the time on when I've extracted maxillary third molars. 2 or 3 away from me, 1 toward me, and 1 away from me. You want to suture it good and tight. You don't want the patient to have post-op bleeding. So we're going to put a 2 roll-up 2x2s on that side, and now we're going to anesthetize the right side. And see, I gave an intraligamental distal to the second molar into the periodontal ligament of that wisdom tooth. So making my cut up the ramus of the mandible, just keeping it in line with the distal facial of the second molar. Don't cut past the distal lingual of the second molar. And then I'm making a cut right along the distal in the sulcus of the second molar. So I can remove that distal wedge, and then I'm using these scissors under the periodontal ligament, cutting up the ramus of the mandible so I can reflect that tissue and have visual access. Don't be afraid to get access. You want to be able to see what you're doing. So I'm removing that tissue, cutting up the ramus of the mandible under the periodontal ligament. I want to do a complete flap reflection, full thickness flap. Now you'll see I'm cutting the bone on the coronal part over the wisdom tooth so I can see the wisdom tooth. I know where it is already, and you can see it coming into view here. Like I said, if you don't have any hands-on surgical training, it's very easy to get lost with the blood and the white and the water and all that. So these videos are not intended to take you from dirt to taking out impacted wisdom teeth. They're meant to enhance your skill if you already have some hands-on surgical training. So now I'm sectioning. Remember I said I wanted to go right off the distal occlusal of that second molar, and that would give me the right angle from the occlusal to just coronal to the furcation of that tooth. And then I've created some space behind the tooth to elevate the distal portion of the tooth into. Got my 301. You see that the distal segment is starting to move. So be very aware of the apical part of the roots. You don't want to section past that. You want to stay clear of that so you don't damage the inferior alveolar nerve. That's a no-no. So I'm sectioning the distal part of the tooth into 2 pieces because the orifice is not big enough to take it out in 1 piece. So I'm dividing it into 2, and I'll take it out in 2 pieces. That's easy. This instrument was very beneficial also to go around the corner, around a tooth and elevate it. There's the mesial part of the root, or part of the tooth. So I took that out in 3 pieces. Now I'm removing the follicular sac. Packing with the medicated Surgicel, and that stabilizes the blood clot so you can maintain it for 7 days, and that keeps you from getting a dry socket. If you can keep the blood clot in the socket for 7 days, you're good. So again, I'm suturing. I'm putting 2 sutures in the mandible. I'll do 1 in the maxilla. The way I came up with this Surgicel at the time of tooth extraction method was when I was in my surgery fellowship for 2 years. We would take out wisdom teeth. We wouldn't pack them at the time of surgery. 3 or 4 days later, the patient would come back with a dry socket and all this pain, and we'd pack them, leave it in for 3 or 4 days, and then they'd be good. And so when I got out of the fellowship, I thought, what if you packed them at the time of surgery? Wouldn't that eliminate dry sockets? And for 40 years, it has. Knock on wood. I don't want to curse my no-hitter, but to my knowledge, I've not had a dry socket in 40 years of practice. You want to take a deep bite when you're suturing so the suture doesn't pull out. And this gut suture will last 4 to 7 days, which is plenty of time to hold the flap together. So I'm placing 2 on the mandible, 2 suture on the mandible, and 1 on the maxilla. Now I'm doing an intraligament, anesthetizing, infiltrating the upper right wisdom tooth, and I'm also doing an intraligamental. Very important, making a vertical incision off the distal facial of the second molar and then cutting behind the second molar in the sulcus and around the second molar so I can reflect that flap. So you don't need a big flap with these wisdom teeth that are partially formed in a younger person. See, I've got a 2x2 in the mouth just in case that wisdom tooth popped out. They're not going to aspirate it. So you can elevate it with either a periodontal elevator or a 301 or that curved instrument. Remove the follicular sac, deep bite. I'm going to place 1 suture most of the time on maxillary wisdom teeth. Now I sedate these people intravenously with Versed and a little bit of Demerol and maybe a little Valium. I don't want them to be wide awake. I'm not putting them to sleep, they're just consciously sedated. Two by twos back there. Now the patient returns in a week, 7 days, with a Scutan syringe filled half mouthwash, half warm water. They irrigate the mandibular sockets because the connective tissue lining has formed in 7 days, so there's no danger of a dry socket. I tell the patient, take the tip of this syringe, go down the occlusal surface of the mandibular teeth and drop it into that hole and squirt a syringe full in very lightly. You're not trying to put a lot of pressure on it, you just want to float anything to the top. And do that on both sides before you go to bed at night. You do not have to irrigate the maxillary wisdom teeth sockets because gravity is working for you. There won't be anything in those sockets. So do this on the left and the right. And how long do you do it? I say, as long as you can get the tip of that syringe. This is the right side. Same thing, take it down the occlusal surface of the anterior teeth and just drop it into that hole and do it as long as you can irrigate it. That'll probably be a week or 2. That's the dental minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are! Subscribe right now to dentistrymasterclasses.com where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.